The first speaker is a final year medical student at the University of Rwanda. She is the founder and the managing director at Umubyeyi Elevate, a community health tech information and makes it easily available and accessible to improve women's health. Munyana Chantal, you're welcome to the stage. Please join us on stage. The second speaker is a young activist and an advocate for promotion of sexual and reproductive health. He is the country director of Afriyan Rwanda, chair of the Global Youth Board for Generation Gender Program, and he's also a member of the UNFPA Global Youth Reference Group, a youth focal point. Evot Libizi, you're also welcome on stage. We have another speaker with us. He's a Rwandan medical doctor, graduate of the UR. Bachmans has 5 years of experience volunteering for grassroots organizations working in public health sector. He contributed to the inception and development of Medical Doctors for Choice, a network for young doctors providing comprehensively sexual and reproductive health services in their respective facilities without biases. Dr. Jean Bachmans Uwimana, you're welcome on stage. Hello, hello. Am I audible enough? Can you guys hear me? Okay. So I'm going to invite, as we can see, we have 3 speakers. I want them to elaborate more on the bio. We've stated, I think, few details on the bio, and we would like to know what you guys are doing and what you're up to. We want to know what you're doing. Start with Munyana, you're welcome.
Thank you so much. Good afternoon, everyone. And thank you for having me today to speak to young people like you about what we are doing and maybe something that can help you do something in the community or inspire you to do more of what you're doing. My name is Umunyana Marie Chantal. As she said, I'm the final year medical student at the University of Rwanda, and I'm the founder and the managing director at Umubyeyi Elevate. Umubyeyi Elevate is a digital health tech solution that aims to make maternal health information accessible and available using digital tools and community engagement services. So what we do mostly is providing information and make it accessible and breaking the biases around reproductive maternal child health. Yeah.
Thank you. We would also love to Dr. Uwimana to tell us about what he does and what he stands for.
Okay, thank you so much for the invitation first. I am Jean Bachmans Uwimana. You can go with Berkey. I know my name is very long. I don't know why my parents had to call me such a very long name. And I cannot blame anybody because it's a tragedy how my name has always been corrected for like at least once on each of my document. When I was checking here, I think it wasn't actually even well spelled, because there's supposed to be an N here in between. But it is what it is, and I take it just like that. You can go with the Berkey. That's what I grew up with since the high school, maybe to reduce a little bit of that stress. And I am a Rwandan medical doctor for choice, who has a special interest in favors of family planning. You may ask me, what does that mean? So we call ourselves medical doctors for choice because we make a network of young doctors who are interested in providing or making access to sexual and reproductive health information and services accessible in our respective facilities without biases. So that's the large network which is actively growing every single day, and it's our mission. It has always been a challenge, that's why we do this, and advocacy has been taking place since the past, let's say, 20 years and so on. A lot of policies have been changed, but without practical examples of service provision, policies are not enough. So there is also a need of implementation of the policies that have been developed, and that's the aim of the network. My interest is about edutainment from Favors of Family Planning, which is a group that features young doctors still with a common goal of using edutainment skills as we provide information. What we do is to employ kitchen materials for hands-on simulation to provide quality, gender, and youth-friendly family planning information, just to decentralize the family planning and reproductive health from the scientific aspect to the level of understanding of many. So that's me, that's what we do, and I hope to explore more on that. If I can give the floor back to you, moderator.
Thank you very much. As the moderator said, my name is Evadenivizi. First of all, above all, I'm a medical student who has enjoyed being a medical student for many years. But the reason why I enjoyed being a medical student for many years is that medical school gave me a platform to grow, to learn a lot, and become a leader. I enjoyed the previous discussion because I could see that they were tackling into all the steps that I've went through, or gone through. So basically, within that platform of learning and growing, I got an opportunity to be a leader. I'm now serving as the country director for AFRI in Rwanda, which is the African Youth and Adolescent Network on Population Development. It's a regional network which has different chapters in different countries in Africa, including Rwanda, and it's focusing on advancing the adolescent and youth sexual reproductive health, the gender promotion, and the youth empowerment. I'm very passionate about the meaningful and inclusive youth participation in policy and decision making. The reason being that young people, even globally, account for the major percentage of the population. So I believe that when you look on the process of shaping the policies or deciding on different numbers of policies and so on, with leaving behind the major population, it doesn't lead to a sustainable development. But when you have young people on board, being part of that momentum, it gives a promise of coming up with the approaches which are very friendly to that population and which are implementable and providing more impact. So there is a question that Angie raised to Dr. Elik when she was asking, does he think a pharmacist student of level 2 should participate in the council meeting? That's very important, because when you look on the real life or the real situation of the education, students face a lot when they are in school. The lecturer can't master everything which is happening sometimes students master the small details. So having an opportunity of the leaders sitting with the student to discuss about how the education can be ameliorated is part of that meaningful and inclusive youth participation. So basically, that's why I'm passionate about that, because I believe in sustainable development which is having a foundation on that meaningful involvement or participation. Thanks.
Thank you, Mr. Evod. I want us, the audience, plus us who are here, to know, I want to give you an image of what we are talking about. Accessing sexual and reproductive health services. Why is there a need? Why should we worry about it anyway in the first place? So I'm going to give you a small piece of information, and then we will use it during the next round of questions. So despite an overall improvement in most aspects of health in Rwanda, adolescent pregnancies are increasing from 6.3% in 2010 up to 7.3% in regard to the total number of pregnancies in 2015. On top of that, complications of pregnancy and childbirth are the second leading cause of death among the 15 to 19-year-old women. Young people are diverse, and so too are their sexual and reproductive health needs. Young people may require information on and access to modern contraception, emergency contraception, menstruation, HIV and STIs, sexually transmitted diseases, in brackets, testing and treatment, gynecology, pregnancy testing and services, safe abortion, counseling, and many more. So young people face a number of obstacles, not leaving out mothers as well, with regard to accessing sexual and reproductive health services. These barriers relate to availability and accessibility, as well as the quality of services provided. So we like have a need for these services. So I want to ask, because they all work in the sexual and reproductive health facilities that provides us with those services, and I had a question for, this goes to Munyana first, and I want to know why you started Umubyeyi Elevate. Who are you looking for? What are you up to? What do you want? Tell us.
Thank you so much. If I got it clearly, you asked me 3 questions. Why I started, what am I up to,
and what do you want? And who are the people you want?
Okay, thank you so much. Why I started, let me start there. I'm a medical student, as I told you, and I'm a mother. So being a mother and being a medical student gave me an experience to see the gap that really mothers face in Rwanda, not only in Rwanda, but the clear picture of what young people till motherhood go through. So I didn't know what to expect. I didn't know who to ask. Despite the medical knowledge that I had, I was longing someone to hold my hand, guide me, this is this, and this is what it is like. So, without knowing that, I was lucky to have the support, to have the medical knowledge, and to become a mother, like to experience it. That's when I realized mothers go through a lot, and it's part of what has been the reason for maternal mortality. Like, you're mentally exhausted, physically exhausted. To some point, you don't know what to do, and you don't know if what you're doing is the right thing to do. And at the end of the day, mothers are dying. Like, we have a lot of women who are dying from preventable causes related to pregnancy and childbirth. So that's why I was motivated not to have the same experience, and not any woman to experience that. Why should a woman die when she's giving a life? Why should that be? It's a natural thing, and it's something physiological. We shouldn't be struggling or suffering because of that. So that was the main motivation for me to start the Umubyeyi Elevate, so that I help those young mothers, prepare them, not only mothers, but from youth who are the future parents, to give them information so that they make the right decision at the right time. So it's been part of the journey, like on starting Umubyeyi Elevate, because access to information was something that I was in need of. You're a mother, you're in medical career, but you don't know when to consult for antenatal care, for example. So who will tell you that? No one. I was lucky that I knew maybe for antenatal care it's advised to do 8 or 4 because they are looking for this and this. But someone who is not in medical career, how is she going to know that? So, yeah. So what we are doing mostly is to provide information, to give them the information and support, not only the physical support, but mostly emotional support, because parents, new parents are mentally exhausted. So we give them information on preconception, not only preconception. Preconception involves the reproductive health, like sexual and reproductive health for youth, as what my colleagues are doing. And also we provide them information on preconception, the 90 days before conceiving, like when you want to become pregnant, what should you take care of? And also we educate them about pregnancies, what to expect during pregnancies, and we complement the national guideline for pregnant women for the antenatal care. We give them information on what is being done into antenatal care so that they are informed to make them useful, let me say it that way. Let me bring this up. We have only 6 doctors for 1,000 people. That means if you go to the hospital, we all know triage. We don't know triage? Yeah, triage is a way of knowing who is going to see the doctor before someone, like who should be consulted before. So if you go to the hospital for just information, you're going to be triaged at the last, because you're not physically ill so that you can be entered to the doctor before, even though you come early. So that means most of people don't go to the hospital for information because they are going to spend a lot of time there. The other thing is, because of the few doctors that we have, you can't have two hours, even 1 hour or 30 minutes with the doctor. He's going to tell you few information because he doesn't have time. There is a long line behind you, people that need to see the doctor. So all of that was the reason behind making information accessible to people. Yeah. So who we are targeting youth, both female and male. We are targeting young mothers and prospective parents. Yeah, thank you.
Thank you, Munyana. Thank you so much. I would like to also ask or direct this question to Evod. Mr. Evod, you said you're a young activist and an advocate for promotion of sexual and reproductive health and rights for adolescents and youth gender. So I want to ask, how does your being an activist or advocate tackle the issue of accessibility of SRH information and services? How do you do that? How are you able to achieve all that?
Yeah, thank you very much. Some years back, I guess it's 4 years. It's in 2018 when I was a member of MEDSA, but I was also having like other organization that I was taking part of, and I got an opportunity to be invited as a youth focal point to the adolescent and youth sexual reproductive health technical working group at the Ministry of Health. Basically, when I reached there, I met Marie Ange, who was presenting with another colleague. They were the two who were below 30 years. But again, the technical working group was made to tackle the issues specifically for adolescent and youth, for the population which is below 30 years. That was the situation of tackling or advancing sexual reproductive health for adolescent and youth at the Rwanda Biomedical Center. And when I tried to look on different presentations they were making, programs that were in the press, approaches that they were using, basically the approaches could come from our parents, people who are of the same age as our parents. And when they are designing those programs and approaches, basically most likely they refer to when they were adolescent, they refer to when they were youth. And our life is very dynamic. So currently, me, when I was an adolescent, some years back, is not the same as the current situation. Which means the approaches which could work on me in my adolescence are very, very different to how, to what the adolescent of these days need. And what do you need to tackle the really issues that the adolescents of today are facing? Is to listen to them, to involve them, to bring them on board. Sometimes they might even bring on board the approaches which are very friendly and very, practical than what you're doing. So in my second meeting, I saw them presenting the programs that were failing. And my first question at the technical working group was, how do you design these programs? And who participate in building these programs? They were the civil societies, the lead of civil societies. They were all that generation of our parents. And they said, this can't work. Everyone was surprised. It was their first time to see someone who is young, who can come and talk about such a thing, maybe challenging their approach. And I said, I will explain. I gave the same illustration. For you to understand what I need, you need the time and my inputs to tell you the really situation that I'm facing. Sometimes I may propose how you can approach what I'm facing. And again, I told them that we have out here the youth-led organization who are doing an amazing work. But again, they are left behind. When you're deciding these policies and programs, they are not on board. When you bring the programs, they are not friendly. We can't adopt them because we see that they won't work. And this is why when you try to design services for the young people, they don't consume those services. You always face the low uptake because you design something which is not friendly for young people. So how the process should work? Please bring more young people in the technical working group, and then they will help to design something that can work. Luckily, I got supporters from the meeting. In a meeting of around 20 people, I got around 3 supporters. But luckily they were having they could speak and people could listen. And then they said, that point is valid. Please organize a meeting of youth-led organization and young activists and put in place a committee of young people who can be part of the technical working group. And that was in 2018, and then we started having around 6. In the next meeting we had 6 young people, and the situation has been ameliorated. So in 2019, I remember we led the preparation of the renewal of the Icpd Agenda renew, the commitment. So it's basically a program which is an agenda which is contributing to advancing the sexual reproductive health, the universal access to sexual reproductive health. And then we did a national youth traveling caravan because we thought like, even if we are here as a committee for representing young people, we need to listen to different young people across the country. So we went through 10 districts in 10 days. We collected the inputs from decent young people from remote areas, rural areas. I mean, we tried to understand the reality that they are facing regarding to sexual reproductive health. That's when we looked that in Rwanda, we had more, some numbers of child marriage. A young person who is, an adolescent who is 16 getting married, and they will tell you that, no, I can't call out my husband, but because they lack the education. All those needs, when you decide for them, they don't get the opportunity to get the real education they need, the information they need, and so on. And then we'll establish the policies which are not responding to the issue that we have. So, the reason why AFRIAN came on board that I represent was to advance that participation, to represent the voices of the youth-led organizations who are on daily basis facing those young people from rural communities, urban areas, and so on, and bring on board the voices of young people to get considered when we're addressing the teen pregnancies, the access to services, and so on. Today, at the parliament level, we're advancing what is called age of consent. A mother or a parent can never think about giving service to someone who is below 18 years. For example, contraception. But again, in 2015 we had 15,000 teen pregnancies. 2018 we had 18,000. 2019 we had 19. 2020 we had 21. 2020 we had 21. And then 2021 we have 33,000 teen pregnancies. Those are below the age. And if those teens are getting pregnant, how do they get pregnant? They're having sex. Will we sustain to educate the young people from not having sex only? Or there should be the alternative? In case this is like this, how do we safely access the services, leaving not behind the information of maybe preventing them to have sex? Yes, but again, the core education should be, even if they decide to have sex, they are educated to have safe sex. The teen pregnancies that we see reflected in the numbers is a red flag for the sexually transmitted diseases among those adolescents and youth.
Mr. Evode talked about using the right approach to reach as many young people, whether urban or rural, to as many people we can reach out to, giving them the right information on how to rightly access sexual and reproductive health services. So I'm talking about approach. I have a story here, a small story, and I would like to first read the story for you, and then I'll direct the next question to Dr. Barchmans. Okay. A story is told of a young boy called Ruhinda, a 12-year-old boy, P4 student, living in Nyaruguru district, Chahinda sector. He has only one parent, his dad, and with multiple other siblings at home, being raised by only the dad. And it brings me to a question I'd like to ask Doctor. So do you feel like the innovations around the SRHR or services, are they providing the right solutions to people like Ruhinda, a child like Ruhinda, in Nyaruguru district? Are we even progressing? So I'd like to ask you to ask that question.
Thank you very much for that question. That's actually an interesting question. Because when you look at the programs in the past and how access to family planning services and sexual and reproductive health comprehensive education, it was mainly targeted to women and girls in the past, comparatively to how men and boys were engaged, which was definitely wrong. Because when you look at the picture of the problem, and at least take some simple examples, you realize that if a female gets pregnant in a period of 1 year, they have the ability of delivering only once. And this is contrary to men and boys who have the capacity maybe to impregnate even more than 1,000 women and girls, depending on how sexually active and how energetic they are, in the very same time frame. So orienting the information to women and girls only and leaving men and boys behind is not a very good approach. So what we are doing for us is kind of trying to bring innovation. We know that the information we're talking here in terms of the local context is something very sensitive. So innovation is very important to at least bend that understanding. That's how we came with also flavors of family planning, trying to take the white coat outside and taking the chef gloves and bringing the doctors in the kitchen and using at least kitchen materials for hands-on simulation to design the information that can be delivered to men and boys in that practical way. And then they will not feel like, okay, if I need this information, I have to go to a health facility or a clinic. But there is also another understanding of bringing the education to the center of people, like trying to decentralize the information from the scientific aspect to the level of understanding of many. For us, we also use the kitchen because, again, looking in our culture, cooking has been for so long seen as a female gender role, right? Yet, then we can use that symbol to address the gender norms around family planning, around reproductive health. Our special focus at Flavors of Family Planning was men and boys, but we still see upon execution process how it attracts, the innovation attracts even the attention of other genders, which is actually very imperative to us. So innovation brings transformation. That's what I believe, especially when it comes to addressing sensitive issues. I will come back again to what Evode just said, which is actually very relevant. Like when you do not engage people at the center of designing the best innovations that can again be the solutions to them and their colleagues, the approach is then wrong. We are so much concerned about boys, about actually adolescents and or young people, because we understand the journey that they go through when it comes to access to information. Here, allow me to give you 3 examples. Maybe it's just like a critical assessment done, but maybe avoid, you can use it in the advocacy approaches while we're talking to the policy makers and decision makers. Why is it so important to sit here and say young people deserve access to information and protection? Young people and adolescents, they face enormous time of physical, psychological, and social changes. And these changes are not preventable. These changes, they are the ones that define why young people really deserve protection when it comes to sexual and reproductive health. Explaining that physically, it's time when the puberty occurs and attractive parts take off. So when we look at young people, we start saying, oh, they look shiny, they are beautiful. So it's our assessment, it's not their problem. It's ours judging them. So again, coming to the psychological aspect, when you look at young people, they are still in the phase of cognitive responses development. So that process of development is very critical, because the cognitive responses, they are the ones that will determine whether the decisions that we take in life are accurate or not. So when you are under development, then that means someone who got the cognitive responses that are already developed, they can take advantage of you. So it's very critical, and there is no way they can jump out of it, because it's a process. It's a physiological process, a psychological process. And socially, again, when you look at the youth age, it's time when the parental influence starts to decrease, and at the same time when the influence of others, including adults and peers, starts to increase. A simple example is like how your parents used to take you when you were 7 is not the same way they take you when you are 15 and onward. Then you are being exposed to meeting other people who can then take again advantage of you. That is unpreventable. So saying that young people, they really deserve protection because of those 3 things that I've just explained, it is very crucial, because even though that process that is not preventable can explain why they can be sexually active, why they can have sex, why they need protection. But unfortunately, most of them are not ready to plan for their families yet. So that is one, access to information then should be open, should not just be left in the hands of the parents, even though the parents will play a very big role, because they are the ones facing or sometimes meeting with their children very often. But again, bringing innovation generally on board to the platforms that young people will meet randomly, then we have come to like a supplement answer to what the contribution of the parents is. I know that giving or engaging men and boys in different conversations and taking them into that process of changing the mindset that the information only concerns women and girls is very relevant, because they can discuss at least that in the family. When we ask the men and boys from rural places, I had to get places, they tell us that I think talking about that is not fit for me because it is for women and girls. We say, okay, can you say it if you had the information? I think if I had the information, I would talk about it. I think the most important thing here is that they don't have information, because most of them, they were left behind out of the program because they were not engaged according to the traditional approaches of bringing solutions in relation to comprehensive sexuality. So, yeah, that's what I can give.
Thank you. Okay.
Exactly sticking on the point, on the kid of Nyaruguru.
Yes.
Well, we're lucky to sit with the two young innovators here. Berkey is a winner of the Innovation Accelerator Phase 2, where they designed that flavors of family planning, which is targeting some users. And today, in Phase 4, we have Munyana, who has gone already in the top 10 finalists. Basically, these are our fellows. They have been a student or they are students. And as pharmacists also, you could have like some of the innovation which can respond to specific population. Today, recently, last year, I think it's the end of last year, I was discussing with the DDG of Imbuto Foundation because I was concerned. We always having innovation which are responding to a certain population. The population which is accessing the internet, technology, and so on. When we design the games, like the board games, when we design like solution on internet platforms, basically they are for the young people who are advantaged. Basically, how do we respond to the issues at the community level, like the kid of Nyaruguru? It comes from us. If we can think about something like flavors of family planning, or if we can think about something like Mobie Elevate, if we can think about a game like Urukundo game, we are also able to think about an innovation which can respond friendly to the young person of Nyaruguru district in remote areas and rural areas. I'm talking about it because I faced the reality. So most of the time you're able to think about that solution when you face the reality. And this is a call for us to open our eyes and broaden our understanding in the field that we are being part of. If we think about sexual reproductive health, we shouldn't think about it as among ourselves as a student who are probably privileged to be at the University of Rwanda. But again, what about those young people who are out of the school, who can't have a phone, who can't have a computer, who do not even know what is YouTube is, Twitter, and so on. So, innovation is not only around tech, and sometimes you can even use tech to impact those young people. You can design something which is physical, which is responding to their need. But again, it comes from me and it comes from you. It doesn't come from the Minister of ICT, it doesn't come from the Minister of Health, it comes from us. I'm very sure some of you who went to university the same time as Munyana, or the same time as Mick, the same time as Berkey, there are people who have never thought about developing something. There are people who did not think about leading a group from one level to another. We're always, Patrick shared the story of Jeff, Kabogo, Mandela, and so on. The pharmacists who determined their capacity at university level, which led them to becoming the leaders of impact in their different platforms. It's not something that they learned at the chair of the campus. No. It is from the challenge to themselves, coming from one point to another, being strategic, understanding where you need to go. If you need to make a change, you should deeply understand the change that you want to make. If you want to make an impact, change, or bring a solution on board, you should understand why that solution is needed. And if someone of us, like if every one of us can think about designing a solution, if, for example, we're 50 here, we can have 30 successful solutions on board to respond to an issue which is emerging. Thanks.
Thank you, Mr. Evott. I think we are out of time, but I want to come back on the story. It's a made-up story. I made this up, so it's not a real story. So I wanted to make emphasis on how the need of information. This boy, what was his name? Ruhinda. I told you it's a made-up story. So Ruhinda, he only lives with his dad. I mean, he lives in a rural area on top of that. So it means his father can't give him all the access to all information. We know that mothers, like Omunyana here, can teach a child the way to walk. Fathers normally don't have that time. So it was purposively to make emphasis. So sexual and reproductive health information should be known by us. We mothers or girls, fathers or even men, young men, to educate. Like for us, we are pharmacists and doctors. I'm glad I'm sitting with seniors here. They're all my seniors. And also I'm glad to be sitting with pharmacists like you. We are the first ones to give information like that to men or women or girls or whoever. Okay? So as we are out of time, I'm sorry, I have to open the discussion to the audience. If you have, I'm only receiving one question. If you have a question, please. Let us take this to hand over the mic. Okay. Dr. Ant.
Yeah, this is very powerful. I like the presentations.
Thank you.
Mbunyana namuonaga namuonya tsindra abona ari award nakukona CPO the doctor. I have seen their work. So my question, ntago ndi bujye kubyo mvugaga bya reproductive health. Yejo shakwabaza. I heard that all of you have a medical background. Yejo shakwabaza, do you think in your career ibyo mukora byose mujya murumva involvement ya pharmacist ari ngombwa? If you are given a position, a higher level position, do you think involving pharmacists is important to tackle health issues?
Okay.
In general,
it was also part of the questions, but we had limited time. So who do you want to direct the question to?
I need to hear every one of them.
Every one of them.
Because
okay.
I don't know, maybe tomorrow
Monyana
may be the minister
please
or...
use 1 minute. I think
Thanks.
all of them. 1 minute or 2. Switch it on. Okay. 1 minute, okay. It's fine.
Thank you so much. I'd like to address this question. I was lucky yesterday, but I was involved in a conversation with big pharmaceutical companies talking about the role of diversity and inclusiveness or inclusivity in advancing innovation in health. So when I was preparing that, I was shocked. Let me read this. Many people, including Martin, Fisk, and David, highlighted the need of pharmacists or pharmaceutical R&Ds in improving or innovating in health sectors. So what does that mean? It means we need pharmacy students. Pharmacy students are health professionals, isn't it?
Yes.
And we are tackling primary healthcare issues. It's not for people with medical background. We go beyond primary healthcare and to secondary and tertiary. But for pharmacists, this is something at your level, primary healthcare. So tackling the issues.
Ziba nziza ari uko zihurijwe hamwe kuko nta gisubizo kimwe wabona muri field iyo ari yo yose muri medical career uvuge ngo iki ngiki kiri 100% perfect to respond and ku bibazo byose bijyanye n'iyo field ntibibaho. Agomba kubaho uko kuzuzanya, agomba kubaho ko abantu bashyira hamwe ibintu bikagenda neza. Nk'ubu nababwira yuko iyo bavuga ngo services ntizimeze neza, abantu ntibabona ibi tuvuga ngo abaganga ntibabikora neza, ibiki bimeze neza. Ariko reka turebe, mbajije abantu wenda bagiye muri clinique gatoya, dutekereza yuko supply chain y'imiti dukoresha ari ikibazo. Ishobora kuba ikibazo iyo ujya kubona umuntu wavuye epfiri yaje kureba, tuvuge wenda ntabwo ndi buvuge contraceptive kuko turi kwivoidinga gato hano, umuti uwo ari we wese ngemura nabyo buri munsi muri clinique ugasanga nk'abantu nakiriye 50-30 bari kwa yarenze ko bajya gushaka umuti wundi hanze. That says we need advocacy in that way too, and I think pharmacists are placed in the best place of Mugati. Come on, people, supply chain igomba guhinduka, abantu bagomba kugira access ni kuri committee igihe bayikeneye. Hari n'ikindi kindi wenda nabonye cyane cyane muri ibyo bijyanye na access ariko bitajyanye exactly na supply chain. Iyo ubu ngubu ikintu kigezweho ni ukuvuga ngo umuntu agomba kubona quality service. Quality service ntabwo ihagararira ku cyo umulaborante yabonye, umuntu ukora muri laboratory, ntabwo ihagararira ku cyo na describinze, ntabwo ihagararira ku ki, ishingiye ku bintu byinshi cyane. Umuti yabonye umufasha ufite quality imeze gute, devices nakoresheje ndimo mutreta zifite quality imeze gute. Ibyo ngibyo rero ntabwo ari ibintu, the chain, the medical career cannot be controlled by umuntu wari we wese. Hagomba kubaho kukuzuzanya kandi ku buryo bungana, ku buryo ki umupharmacist aza contributinga, nurses baga contributinga, twese tuga contributinga kugira ngo icyo dukora kibe gifite quality kandi ari cyiza kibereye n'uwo tugiye kugira. Iyo haguzemo kimwe, it's not quality anymore. So nibaza yuko nkamwe mwagombye gutangira kuba engaged mu yandi association, mu guhura n'ayandi association, kuyahuza mukayabwira nk'ayo magambo, akumva yuko icyo tugambiriye no kugira ngo healthcare ijye ku rundi rwego, ntabwo ari ukugira ngo kuko nta muntu n'umwe muri abo ngabo yaba ari medical doctor or anyone ushobora gutanga igisubizo kiri 100% perfect without engaging the entire team.
Babare no membere kimazi avuze akantu keza soza aho ngo ama-association yose akwiye kugira anahurira kugira ngo atange igisubizo kiri gifasha wa muntu dufasha, sibyo? So you are medical doctor, uri muri ya association yitwa gute? Apana y'abanyeshuri, ya professionals. Yes. Twari your message. Nanjye nitware muri council n'abandi tutware muri council, then tutagira duhurira kugira ngo tuzagerwe, sibyo?
Doctor, nashakaga nanjye gutakoringa ikibazo watubajije.
1 minute.
Actually, yeah, thanks. Naje mfite gahunda yo kubivuga. ibibazo byose duhurira nabyo muri family planning cyangwa se access to service, especially contraceptives, aba pharmacists taking the lead, breaking the core barrier. Good. The core barriers zituma tubinyuma cyangwa se abantu bakabifata nka politiki ya leta byari ndibiri negative. Yes, in politics it's a good politic. Family planning is a good politic. But if umuturage avuze ngo iriya ni politiki ya leta, it becomes something negative. Sibyo? But again, what is the reason? Because of the myths, the misconceptions. Byinshi ugasanga biri rotating around the side effect uyu yahuye nayo gutyo. None usanga pharmacist akenshi loro baprayinga muri family planning. They are the pharmaceutical firms producing contraceptives, and then muri yo channel yo kugira ngo bigere ku muturage. Sometimes I believe system yumva ko aba pharmacists bahagararira hariya, but the pharmacist can control the interaction between a pharmaceutical, a contraceptive product, and a beneficiary, the user. Uko wamusobanurira kugira ngo izo myths na misconceptions zivemo ayikoreshe mu buryo buri friendly, wamusobanurira neza kurusha uko namusobanurira neza. Basically niyo mpamvu mvuga ngo it should even be one of the intervention of RPSA as you make the outreaches. Also touch that. If you're a pharmacist, please think about how you can facilitate the access or the uptake of contraceptives. Niba mwumva drug interaction ku mubiri w'umuntu, ni gute twa breaking zira barriers zo kugira ngo abantu bumve ko gufata family planning method cyangwa se gukoresha contraceptives bitagarukira hariya, bitari common, bitari generalized. So if you start from there, you may end up becoming like a lead of family planning at the national level because you have started from there. You start from there to the global level. I believe that a pharmacist can lead the family planning better than anyone else.
Yes. Thank you so much, speakers, for this session. We'd love you to get back to your seats, and thank you for participating. And the audience, thank you so much. This is the end of our session. Let me welcome the MC.
A round of applause again to the panel. So we are running out of the time, and we have one more session plus something else that I want to tell you. So I'm not going to comment on what they have been saying. For sure it is interesting, and I know that every one of us have learned a lot from them. So we are going to take a very few minutes, like 10, not more than 10. And we give it to Urukundo board game. They are going to have a short presentation, and after that we will take over to the next panel. Welcome,
Yes.
Urukundo.
Actually, it's not a presentation. It's a game, kind of refreshment, so that we're heading to prepare the panel of the second panel, which is the last one. So I hope you won't get bored. I would like to invite people from Urukundo. It's going not to be more than maximum 10 minutes. Please, you are welcome. You can clap for them as they are coming.
So come quickly.
Niriwe, nitwa Teta, nkaba mvuye muri organization yitwa Urukundo Initiative. Dukora ibintu bya sexual reproductive health awareness. So, imwe mu products yacu ni Urukundo board game. Ni board game iri mu ndimi ebyiri, English na Kinyarwanda. So, kuko dufite igihe gito tugiye kwiga ukuntu dukina game, and then nk'abantu babiri baze dukine, and then for more information you can visit us kuri office, our game center. It is free to play, so you're welcome to come and play. So ndumva ari ibyo, we can get into playing. Yes. Tugiye gukoresha hano, murareba mwese se? I will raise nzajya mbizamura, ikibazo nuko mutebone mwese, ariko ngiye gukoresha hano kuko I think
Kumeri no.
Okay. So package ibigizwe n'amakarita y'ibisubizo, any answers, then n'ibibazo, Q, questions. Then hari utuntu tw'udusaro batwita diamonds, baduha abantu batsinze. Iyo utsinze baguha diamond. And then izi ni guidelines zerekana ukuntu mukina game cyangwa se facilitator guides. Then ikintu ukoresha gukina ni board ibiriho start button, start akanuza ka start no duhera dukina, and aya mabara yose ari hano ku ruhande ari mu cards. Each color iba ifite cards, hari cards y'icyatsi, ubururu, byose. So hanyuma utundi tuntu tubiri, but ari tubiri batwita dice, and then akabakita token. Niko dukoresha kugira ngo umenye ahantu iyo umaze gutosinga dices, umuvinga token according to the number bakoretse kuri dice. Yeah, so I'm going to show you, but since ko mwese muri bubone, we will try. Muri? Where? Okay. So, board ibiri hano. Okay, I'm sorry when I lose it. But the objective of playing the game no kwigisha kuri sexual reproductive health. It is something usanga we don't talk about as youth, but it is again something that we need to know. So game idufasha twashatse kubinyuza mu buryo buri innovative, different from uburyo busanzweho, apart from panels and books and everything. So we use a game where you can learn, there are questions and answers, and you can discuss. So ukagira knowledge about sexual reproductive health in an innovative way, or in a way it is fun. So twe niyo mpamvu we put in a game. So I think that is understood. So iyo tugiye gukina ni byiza ko nkuko nababwiye amabara ari kuri board agiye ari mu makarita, rero ni byiza iyo tugiye dushyira amakarita according to colors. So nabanje kubigroupinga. We have color green, color red, color yellow na color blue. Yeah, so iyo tugiye gukina nkuko nababwiye tuba dufite dice. So you toss the dice and then umubare uri hejuru, igiteranyo cy'umubare uri hejuru nicyo kidetermininga what question you're going to answer. Nkatwe dufite number 6 twatosinze, then 5 plus 1 is 6. So iyo ufite 6, token yawe ibiri kuri start. I don't know if you can see it behind. Okay. Ibiri kuri start. So uyita imibare iri hasi hari imibare munsi ya colors 1 2 3 4. Mukibona? Yego. So ufata start token yawe ukayikura kuri start ukayizana kuri 1. So twabonye summation ya 6 twebwe. Ufata ukazana 1 2 3 4 5 and 6. So 6 ureba muri amabara ari hejuru kuko questions are either in color green, blue, red or yellow. So 6 ikibazo kiri hejuru ya 6 ni number 3. Ubwo ni question 3 muri green. So you do question 3. Twayibonye question 3. So you read the question, then muka discussing a quick question, and then mukaza kwa nimba watsinze cyangwa utatsinze. So question 3 iravuga ngo the most fertile time in a girl's menstrual cycle is 12 to 16 days before her next period. A, true or false? For A ni true, B ni false. B, kadukoresha uyu avuze B. No, it's just an example that avuze B. So tugiye kura muri answers, ubwo turebye answers tureba answer 3 ya question 3 yavuze false. So A3 yavuze B. So that means ko yagikoze. So B iravuga ngo because hasi haba hariho ubusobanuro why they say the answer. So nimba yavuze B, because most girls do not have regular periods, it is very difficult to work out when the most fertile time is. It is difficult to work out when the most fertile time is. Even if periods are quite regular, we can only estimate when the most fertile time is. Stresses, exams, losing weight can all affect the cycle, and also relying on working out when you're likely to be most fertile is not a good way to protect yourself from pregnancy. So yatsinze yavuze B, ubundi ukuntu bigenza ashobora kuvuga B, you brainstorm Y kugira ngo you also learn. So iyo umuntu atsinze, tuno tu diamonds nabwiye ko baduha umuntu watsinze. Iyo umuntu atsinze umuha according to the color yagize yatsindiye. So ni ubwo tumuha agasaro ka green kuko yatsinze. So to be quick, this is how you do the first phase. And iyo undi muntu akomeje gukina, tuvuga arasoje mugenzi agiye gukina, ntago token muyigarura kuri start. Token ihera kuri number yaririho. Nimba ari kuri number 6, ubwo that means turabara duhereye, turakora 6 right ka number 1, turongera tugatosinga dice zacu to this, ubwo tubonye 3 plus 2, 5. That means turafata 6 irahitiba 1. 1, 2, 3, 4, 5. Mugakomereza, ukomereza aho wari uri, ntabwo usubira inyuma. So 5, that means 5 yakigeze kuri 10, hejuru harimo umubare wa 10. Ubwo ni question 10 in green. So that is how you do the game. Hanyuma iyo tuvuge tukomeje tugakina, hanyuma hakaza ugahitamo ikibazo cyabajijwe. For example, ndatosinze diamond, nongeye nguye kuri question 3, kandi question 3 yavuyemo. Iyo nimba ari uyunguwe watsinze, twamuhaye agasaro ka green, that means ko ari bugatange, ahita losinga diamond back. Iyo udafite ikintu utanga, if you don't have a diamond, uhita uva mu mukino, uvamo then abandi bagakomeza. So you keep playing, and umuntu ugira ama diamonds menshi niwe winner. So I try to summarize. I don't know if we can play one person. Sorry? Obviously, umuntu utsinda aba yasubije ibibazo neza. Ego. Yes, so kubera igihe cyagiye barambwiye, if you want to play, ndikumva tutari ku muntu gakina kubera igihe, but if you want to play, please feel free to come to the game center every Tuesday. Haba hari abantu baraza ku game center bagakina, ni Remera opposite na stade mu nzu yitwa KIGALI house. Thank you for your time.
Thank you very much, Rukundo. I think this is really interesting. Nuko tutazumvise neza, ariko you guys are welcome. Sorry? You are welcome anytime. You can visit them with the very educative sexual and reproductive health. Thank you very much for coming. We are going to... Yes, please.
Yeah, I was saying that we have that kind of teaching method by game in pharmacy as an innovative educational technique. Yes, you can read on it, or I can try to read and try to give an example, apply it to one of our modules to see how it can work, really.
Thank you. So we go to the last panel, and I would like to welcome the moderator, Julie Maeva. You are very welcome. Good afternoon, everyone. Can we stand up a little bit? Gigi, do we have some music? I believe conferences and gatherings like this are platforms where we get to be exposed on what is currently going on in the pharmacy sectors. And I believe during those 2 days we've been learning a lot, theories in our education, in what is currently happening, as well as areas where we can innovate. I want us to stretch a little bit because we've eaten, we are coming from a session, and we are going into another session, so please feel free to give us your best moves. Find yourself a partner, and let's stretch a little bit for 5 minutes before we start. Is that okay? Okay, I believe the music is taking some time. Can we agree on having a conversation? Yes? Because I want this to be practical. We've been hearing so many things about innovations within the pharmacy sector. And at the end of the day, I'm wondering, what package are we leaving this place with? So I want us to have some practical skills, some practical attitude and mindset that we can leave this place and go to apply in the pharmacy, in our profession out there. We've been challenged by medical students out here, and at the end of the day, I'm thinking, I've been particularly challenged because at the end of the day, I'm thinking, I'm a pharmacy student and I'm already out of school soon. What innovations did I bring within the pharmacy sector? I don't have an answer. Anyway, anyhow, I want to welcome pharmacist Geoffrey here. He holds a bachelor in pharmacy. He as well have a master in public health. He has held various professional positions in different organizations, such as quality manager in Babil, Rwanda. He has been the operations lead at M-Pharma Africa, and he's currently working with the USAID Global Health Supply Chain, and as the advisor, strategic advisor to the CEO of Rwanda Medical Supply. Can we please give a round of applause? Secondly, I want to welcome a very beautiful lady. She's having so many caskets, yet she started with pharmacy, and I believe we are going to be challenged by her as well. She is called Christelle Chimwamucho. She's an accomplished pharmacist, medical and pharmaceutical marketing officer, page and coach, event planning, HIV activist. Please. We're going to talk about leading beyond pharmacy. When I hear leading beyond pharmacy, I'm thinking of what are some of the areas where we didn't think pharmacy, yet we saw pharmacy in there. Can we agree on that? Can you guys think of any area where we didn't think pharmacy, yet somebody who studied pharmacy is working inside there? Can you think of any? She's a patient coach. You guys, come on. We said this was going to be a conversation, isn't it? She is a patient coach, an event planner, and an HIV activist. Can we clap for her again? Like I was saying, when I think leading beyond pharmacy, I'm thinking of sectors where we didn't plan for pharmacy. So I want to start with you, Christelle. Can you please give us your journey? How did you start? Where HIV activists came from? Where she's a TV presenter as well. how did you start that? Can you please tell us about that?
So thank you so much for having me. It's a great honor and I'm so excited. And I remember when I was at school, I have never attended any symposium because...
Thank you to the organizers.
No, it's not something good because while others had to attend, I was working fully. So you are just lucky. And before I start, know that I remember last Tuesday, I was reading something on Forbes, and they are saying that medicine, pharmacy, and other related fields, now they are in the top 20 jobs of the future for the 50 to 70 years upcoming. So guys, where you are in the right way. Even if you can go in other things to do, but you are in the right way, and if you really you have the passion for the pharmacy, you like what you are learning from school, go, just give your 200%. I know that it will pay. So I started being an HIV activist. I don't know if among all the attendance, someone was there in 2000, maybe in 97, 98, 99. That time, the HIV, it was SIDA everywhere, AIDS. So parents were dying, cousins, friends, everywhere. So that time it was really very scary to have HIV, to know that you are having HIV, ARVs were not there. So it was really so hard to be a young children, to see your parents dying, or your friends, or your aunts. So for me, when I started the secondary school, I was, during the O-level, I was at the Lycée Notre-Dame de Cîteaux, and that time we had one group called Service Adopol. So our duty was to go to visit some patient at CHUK, at CHUK. So we were visiting all the wards, we were visiting all the rooms, from pediatrics to internal medicine to emergency to surgery and so on. But in the internal medicine, like 70% there of the patient were having HIV, and they were on their own. No one was there to take care of them. So for me, it was hard. I remember I met one woman there. He told me that, they were having some photos, and she showed me the photo, and she was like, I was so beautiful. I have like 5 kids, but no one can come and visit me. Because we were visiting them, we were touching them, we were giving them something to drink. And for her, it was, why are you doing this? I was like, even if shake your hands, I know that I'm not going to get the HIV. Even if I sit with you, I know that I'm not going to get HIV. And I was like, why are we having those kind of treatment to people living HIV? So that time it was the stigma, everyone was having that. It's not the stigma that we are facing now. That time it was really so hard, even if to open to your family that you are having HIV. So I started by there. I was, when I had my tour to go in the room, so I was not going to the emergency or to the surgery or to pediatrics. Directly my law was to go visit those patients having HIV. So I started by that. Then I went to secondary. I changed the school. So for the section, I was in the biochemistry, biochimie at Groupe Scolaire d'Optare. So in that time also, I was every time talking about HIV. I was, guys, you have to protect yourself. I was doing it the fun way. Do you know that even if you just have to keep the condom? I was talking to my classmates that way. So, and then after I joined another group called they are just young, living with HIV. So I joined the group. I was with them. I was coaching them. I was, having fun with them. Then I've seen that even if we're in 2022, people living with HIV are still really struggling a lot to get the treatment that are there, the medicine. The treatment they are getting from the hospital is there. Even if some people in some location, you go there, people they do understand, but still the stigma is there. So for me, I cannot really sit and be quiet when I'm seeing that kind of treatment. Because, do you know that there's some jobs that in Rwanda you cannot really apply when we're having HIV? And I do not understand why. Yeah, so I started being an HIV activist from secondary school. Then also the lecturer was asking what is the pageant coaching. Nowadays we're having what we call amarushanwa y'ubwiza. So beauty pageant. So I'm a beauty pageant coaching, not queen, coaching. Because sometimes they think that it's easy to be in those kind of competition and win. But if you don't have a team behind you, they're going to coach you how to speak, how to stand, how to pause, what to say. It's a long way. So I'm doing it. It's not a job. It's something that I'm doing for like a hobby. Then also, but I'm still in the pharmacy. I'm working Monday to Friday in the pharmacy, not in the retail pharmacy or in the wholesaler. I'm working as in the health system partner in the oncology department, where I'm trying to contribute to build a sustained ecosystem in a way that a patient, if my mom or anyone I know, one day he will maybe be, or she will maybe be sick, she could access at the right time the right treatment and soon as possible. Because we know that for cancer, today if we are sick at phase 1, and if you don't get the treatment in 2 months or 4 months, maybe it will be so late. So thank you so much for having me, and me voilà.
Thank you very much. Can we clap louder than that, please? One thing that I'm getting from her speech is the way she got the solution, or she saw a problem within the current environment she was placed into. And that brings me to some of the innovations that we have been talking about earlier. And I just want to bring back the fact that sometimes innovation doesn't go far. You don't have to think innovations as if it's something huge. You can start as small as the place or the environment you are placed into. And you can draw a challenge from that particular environment that you transform into a problem, you transform into an idea that actually becomes a solution to thousands of people. Jeff, coming to you, I want to ask you, what are some of the areas where you think that when we say pharmacy from the beginning, pharmacy was not really mentioned in that area, but nowadays she was saying that our profession is assured for the next 20 to 30 years, which is good. But what are some of the areas where from the beginning we didn't think pharmacy, but now pharmacy is actually acting in the middle of that?
Thank you very much. Good evening to the participants once again. I'm very privileged to be here, and I've been trying to connect the dots. You see, these two ladies here, allow me to first say this. Maeva is so much happy to host this Crystal here, and I'll also tell you why I'm happy to share with them the panel. I was leaving the university. I was in my final year, or probably getting out. So I got calls from the university, and they were telling me, Mr. President, they were still calling me the president. Mr. President, do you know there is a pharmacy student who is among the finalists for Miss University of Rwanda? Then I asked myself, who could that be? Then when I went back to the university, I asked, who is that pharmacy student that contested and reached finals And I think they showed me Maeva. That was my first time to know Julie Maeva. So, and I was completely happy. So you see, her being seated with now a pageant coach, there is that connection. You understand? And another reason I'm very happy to be on this panel. Recently, some of these days I do a number of radio shows about healthcare and a number of health topics, starting from the COVID period. I think some of you have been hearing me. And one of the colleagues, Christelle's colleagues, told me, hosted me and said, do you know Christelle? I was like, I don't know Christelle exactly, but I'm supposed to know every pharmacist in Rwanda. So they told me, there's Christelle, we work together at Isha. So they told me about her, and I have always been waiting to see her. And I'm happy. I've remembered the face, but I didn't connect the two. Yeah, so I'm happy. I'm happy that we're having such people. And I'm going to start from there exactly to answer your question. Today we have pharmacists working in various fields. We have 2 pharmacists at the New Times Rwanda. You know that? We have pharmacists working with 1 Acre Fund. This is an NGO that is working in agriculture. And we have pharmacists who are working in those good, in positions that are leading such an institution. Now, why? To me, I would even tell you a pharmacist can work anywhere. But you can ask me why. My question has not always been asking where can a pharmacist work? When we completed the university, we were in our 5th year. And now I can boldly say this. I wouldn't have said it when I was still in 5th year because the head of department wouldn't have been on my side. But when I was in my 5th year, I was interning at the Rwanda Military Hospital. Then there was this booming company that entered Rwanda, and they were doing innovation, and they were bringing clinical services on the phone. And this was the talk of the city, everywhere we went. And then I talked to a few colleagues of mine and I was like, we have to be part of this. We don't know how it works, but we must be part of it. We didn't know really how you can treat a person over the phone, but we said we must be part of that. So we went, and 3 of us went to their office. Then we came to the office and said, we can work for you. Simple as that. Well, you are still students, what can you do for us? We like, yes, we can do our internship, half a day we shall work for you. We don't know what you do, but we are going to help you make it better. and basically, this is not a job. This is how we told them. Then we went back, found our seniors at the National Pharmacy Council. There was pharmacist Patrick Nganj. He was the registrar by then, so we told him, you know what? We want you to take us to that company. We don't know what they are doing, but we want to help them do better what they are doing. So we went there. So we didn't know what to do. They didn't know what we can do. So they said we shall take one. And then that one was me. Then I entered. Then I told them, give me what you can do. Show me what you want to do. Then they showed me what they want to do. So I started interning at Kanombe and also interning, working with them in half an hour. I think that happened for like 1 month. Then another month I was hired. Then we started. So basically I became part of the team of developing the solution, like how can we treat Rwandans on a phone. They already had a solution that was working in the United Kingdom, but it was not compatible with the Rwandan population. So our work was now to customize the Rwandan population. Nigute wafata service ubuvuzi kuri application ukazishyira kuri karashara. Now that's what we started doing. For the first time I saw how a pharmacist can contribute to everything. My question has always been, why is a pharmacist capable to do that? The answer is simple. Not every Tom, Dick and Harry can do pharmacy. Pharmacy. So pharmacy, medicine, it is the cream de la cream. So when you take these people, bring them to the university, the capacity of your brain did not stop in secondary when you scored very well to come to the pharmacy school. The only problem is when you come to the pharmacy school and you want to confine your good brain that got an A in mathematics, in physics, in chemistry, in biology, and you want to confine it only pharmacy, then you are limiting yourself to what you are capable of doing. You are capable of doing a lot of things as long as you allow yourself to get exposed. Okay? So over the past years, at least from the time around 2013 from there, when we were at the university, we have seen pharmacy students going everywhere, competing for various positions. We got pharmacy students winning to become leaders on various international platforms. By the way, those are the ones that we know, those who passed and led, became leaders. But there are those who even contested and failed. It's part of the journey. Try, you fail. It's part of it. But you are capable of doing everything as long as an opportunity is presented to you. But you also got to prepare for that opportunity. So, to answer your question in a nutshell, is that pharmacists can be everywhere. If we can have a pharmacist in a newsroom, writing news, editing news, we have pharmacists who do sports. They write articles on sports. We have pharmacists who do, basically in every field, we can find pharmacists. And even those fields where we have not entered, I'm here to see a pharmacist who is wearing this, I don't know the name, the things that, and is a lawyer. I'm here to see a pharmacist doing that. I can assure you. And I think, so maybe people who know pharmacists already know that. Pharmacists can do everything. Why? Because we have the capability and we have the capacity to do everything as long as the opportunity is presented to us. What we are going to start doing one of these days is to hunt for those opportunities. The likes of what Christel have done, identify the challenge, turn it into an opportunity, venture into it. Then let's start. Sometime back before I joined university, I did a short course in radio presentation. That's one of the things I have never put to use. I have not hosted a show on a radio, but the skills I gained from there are helping me today when I'm hosted on the radio. I haven't hosted a show on my own, but I am hosted on various shows. So why? It's because different skills that you can gather from everywhere, you can put them to use. Because as a pharmacy student, I normally tell students when we are together, like, if you can pass pharmaceutical chemistry, you can do everything.
Thank you. I think after what he said, we can close the books and go home. What do you guys think? But staying on what you were saying, Jeff, one thing I like about your statement is the way you shoot your shots. Basically, you've answered all of my questions, actually. But it's the way you shoot your shot with Babil, like the boldness. Like I was saying earlier, I want this to be a bit practical. What are some of the skills that someone needs to have when he wants to get into that sector where he didn't think he was? He has a role to play, but I mean, he knows he has a role to play, but he doesn't know how to get that role off his head to the actual environment. I'm taking an example. Yesterday we had the country director of Chemonix. I'm sure so many people in the room were amazed at the fact that the country director of Chemonix is actually a pharmacist. But then, and I'm even sure that people had Chemonix into their dream organization, like finding themselves working in Chemonix one day. But then they are still at the student level, means that, okay, you need to start somewhere. That is, for example, with an internship. Getting into the internship and then making people to see what you can do. But even before getting into that internship, you need to make sure that you know how to market yourself. So what are some of the skills that we need to have that when we, I don't know, if we meet Chemonix, GHPA, Go, I don't know, like lawyer or stuff like that, into which we're interested, how do we shoot our shot?
Thank you very much. And one of these days, you know, Dr. Eric is part of the people I'm supposed to be respecting according to the hierarchy of leadership. But I'm going to give you true life examples. Me, I'm someone who likes giving true life examples from myself. doesn't mean that you are going to live or do your things like me. But here's the thing, and I'm going to dwell so much at this thing at Babil because that was my first entrance. You know, when you are seated here, like my colleague here, the president of RPSA, it's tricky how you get out of being a president, again start from below and go up in the professional ladder. So when I entered there, this was a big company. When they entered in Rwanda, they hired every expert in the field of medicine. They had the best ITs, they had the best doctors in the city, and they had put them together to come up with something. And I was part of that team. I'm going to kind of re-echo what pharmacist Maurice said earlier today. I was in this team of experts. I was the youngest and the person who was less experienced. But I had my ideas. But your idea can often be underlooked, undermined, and no one wants to, what is this young boy talking about? You need to be humble. You need to be humble the way you talk about your things. You need to be disciplined. At times they will counter-urge your statement, and you know it's right, your idea. But how do you argue back? How do you clarify your statement? At times at that point, it takes a personal character to know how to read the environment you are in. So, for me personally, what I did, I first looked at all these people and knew no one is going to be listening to me unless I get away of being, even if you challenge them, it even becomes a problem. But what I was trying to do was bring your idea. No one listens to it. Go back, put it in a different form, whether in writing, whether in something you'll come up with a graph or a graphical model or a mock-up of any sort, bring it in a tangible way and show it to them again. You know, but in a humble way. Don't want to challenge them. You don't want to challenge them. You are still young. No one minds about you. You understand? So it takes your personal discipline. Then another thing, be reliable. So in a teamwork, they will say, in a team, you do this, present. Do self-sacrifice, like he said. Who can write for us? Who is the secretary of the group? I'm the one. Who will present? I'm the one. Who will do? I'm the one. So now, in the end, everything gets centered on me. Because these are old people, after all, they start even getting fatigued. Okay, he will write, he will present. So now, when I'm presenting, I even present things they did not tell me. That's where you start now showing that you have things to add. I always tell you, I'm very stubborn when I have the microphone. Everyone knows that. You cannot control me when I have the microphone. So they give me what to present, I come and add my flavors. You understand? So, whoever is there and we are presenting to will not mind about the team that is seated there. They start asking questions about the presenter. So they ask me. You understand? So, in all that, you need to have that. Be humble, have that kind of self-sacrifice, then be disciplined. So when they could say, tomorrow we are going to present, and if the presentation is at 9, I would be there by 7. They find me in the room, I'm rehearsing, I do everything, all the preparation. So I was always prepared, So there are those simple, practical steps that you need to take when such a thing happens. I remember in one of the sessions, then I stood up and told them, in one of the cocktails, I told them, I'm happy to be here. Everyone came here selling their CV. Everyone came here having a good CV they were selling. Me, I came here with nothing in I just had myself with my hands. But I'm happy that you gave me the opportunity to be here because I didn't have a CV. I told them, I was trying to show them that I'm here just by myself. You understand? So you need to have that at the back of your mind. And when you come out of the pharmacy school and you want to start venturing into these things, guys, you need to know one thing, that you are starting as a junior. Basically, look at yourself as when you are starting in first year. You have titles here when you are in pharmacy school, you are leaders, but when you reach there in the professional environment, now you start again. So when you start again, that's the point where you need utmost discipline, utmost, being humble, understanding the environment you are in. So those are the things that I employed personally, and others can look at other things that you need to employ, depending on the environment that you are in. I am sure Christelle could have employed something different.
Christelle, do you have a say on that as well?
So thank you. I could say that also having an open mind, you see, because most of the time, when they tell you that you are a pharmacist, you are a medical doctor, it's like, there's kind of jobs you have, you cannot carry a carton, you cannot carry a jerry can, you cannot, you see, yourself you are starting putting in your mind that you are someone very important, and it's not true. You just have to have an open mind, to be very flexible, because most of things that we are learning in the school, in the practical way, we are going to use like 40%, maybe less. So you just have to learn everything, new things when you are out there. I remember my job that I'm doing, it's also mixed with a lot of marketing. So I've not get any courses of marketing in the schools. So, but as I have to do that kind of jobs, I was taking some courses, online courses. I was watching a lot of YouTube videos. I was trying to empower myself. Because if I have a job, I'm not going to explain to my boss, I cannot do this because I have not learned it in the school. You see, you just have to have an open mind. You just have to be very flexible, and also to have the discipline. Yeah.
Thank you very much. I don't know if you guys are enjoying this, but I'm definitely enjoying this. I'm getting humility, discipline, reliability, open mind, as well as have a keen eye, a keen to identify areas where you need improvement, areas where you need to grow a little bit. And one thing that I'm getting from what Geoffrey has been saying is that even before reaching to that stage of going to ask or present at Babil, he had exposure, and exposure came from those student organizations we've been involved to. If you realize, well, the fact that maybe he knew how to make a presentation in front of people, it's because he had that exposure previously during the university years onto how to make presentations. So I just want to emphasize on the fact that even though, I hope our lecturers are not going to kill me for this, but even though pharmacy school is there and we have to make everything in the right time to make sure that our studies, our courses, we are passing our exams and everything, it's not the only thing we should do actually during university. We should make sure that some skills are developed. That is how to make a presentation, how to make use of Microsoft Office, how to make use of the different online platforms, because nobody is going to tell you how to do that. It's something you are going to reach on the market and see that it's actually something that you're missing. Okay, now that, as she was saying before, sorry for that. As she was saying, I lost my ideas. But anyway, the point is we should make use of our university years in all the areas. That is making sure that we are getting out with a degree, because I believe the degree is what shows us the door. But what makes us enter that room is the skills, what we can apply practically on the ground. I want to give the floor to the audience. Do we have any questions from you guys? Okay, how many questions do we have? I think I have 10 minutes left. 1, 2, do we have another one? Guys,
guess we agreed this was going to be a conversation. Now you guys are not asking questions. Okay.
Thank you very much for the presentations. Zari zimeze neza. Genda shako tufatikanye panelists tuvuge ibintu practical sibyo. Jemura bwa mbere na Bengana. I was doing some consultant services for Rwanda NCDA. Yashaka partnership. You remember? Yaraje aratwemeza abona ibintu bifatika ariko ngira ngo byaragiye bakoranye. I left. Icyo shaka kuvuga nyine, if you have a target, ugomba gukora ibishoboka byose kugira ngo uyigereho. Yewe ikintu ushaka kumufasha to tell our young people, brothers and sisters, ndabibaza mu kibazo, then you will answer. Ariko the comment you make, then they will help our brothers and sisters to make their decisions for their future. Ufite akazi kari imbere yawe, ariko hari icyo wifuza kuba cyitwa B mu myaka 5-10 iri imbere. Icyo wifuza kuba mu cyitwa B kizaguhemba wenda miliyoni 1, sibyo, ku kwezi. Ako kazi kari imbere yawe karaguha $800 ako kanya, ariko kugira ngo uzagere kuri ya miliyoni biragusaba guca mu kandi kazi kazaguha nk'ibihumbi 300 mbere yo kuzagera kuri ya miliyoni. Kandi ka kazi kazaguha kuri ya miliyoni nizo nzozi zawe, niyo passion, nicyo wifuza kuba cyo mu kubuilding career yawe. So niye nabo mwagira bano barumuna bacu mu gufata decision. Let me say urotamvuga iki kintu Etrodi mumbabara mbivuge, nkunde kuvuga ibintu practical. Ndi mu wa kane, hari mukuru wanjye waje wari imbere yanyu mwaka. Barangiza hari akazi kenshi gahemba. Icyo gihe hari NGOs zitwa MSH niyo yavuyemo MTAPS, hari FHI zafataga district pharmacist bahemba $800. Hari cyitwaga iki cyavuyemo hano Dr. ubwo RPSA muri Minisante yitwa nde uyu mudamu sinibuka izina ryacu Dr. Anita, yes, asimwe PSI. But before they had Kigwano hafi ya Serena track person. Icyo gihe bahari mu pharmacist bahemba neza. Noneho uwo mukuru wanjye araza arambwira ngo barashaka muri track bamemba $800, ariko hari ahandi banyemera akazi right now kamemba $450. Ariko aho hantu bari muri $450 umunsi mu myaka 10-15 nzaba naravuyemo ikindi kintu gikomeye. N'inzira zigaragara barabikubwira ukabona nyine birashoboka. So nubwo nigaga ariko nari mfite imyaka myinshi, yaraje aranganiriza ndamubwira ndi wowe nafata kwa $450. Yarantunganije, ariko no munsi byarangiye abyemeye areka kakandi ka $800 afata ka $450. Uyu munsi MTAPS ishashe consultants niwe bafata, ntabwo ndi buvuga izina rye. Chemonix ishatse consultant amahirwe menshi niwe bafata, n'ibindi bigo biri muri domaine yacu. Jewe myself ndangiza nagiye kuri uriya umwe muri bari sponsors banyu, ntabwo ndi umuvuge, nabaye umunyapolitike. Yarabamagaye nsanga hari umukonfrere batandukanye yamuhembaga amafaranga $200,000 niba nibuka neza. Ngezeyo arangate ndabutangiza iryinani ngo nyine ngende ngo ngiva ku ishuri urumva undi yaragize kuri $200 abaza umwaka bakorana. Ati we ntabwo nagutangiza adresse ndagwa saka treve. Umwana umva muvandi nibwo bwa nyuma umbonye imbere y'amaso yawe nahise nkatataha. Icyo nifuzaga, ntabwo nifuzaga kwiga ibintu byo kuboroka uburokore cyangwa se gukorera umuntu private. Buri gihe namwe nshaka gukorera leta ariko nshaka kwidevelopa. So nakoreye leta imyaka yose kugeza munsi. Nyine nafataga rwa rusenda turimo turana bavandi mumfashirize bano bantu. Nafashe decision simbizi, narayobye simbizi, ariko reka tufate bano bantu baciye muri zo nzira, wenda agenda narayobye, wenda badufashe kugira sibyo, badufashe kugira inama, kubera ko abo twiganye uno munsi nta wundi ufite PhD. Ntabwo bivuze ko PhD duhembwa menshi, mubaze ntabwo duhembwa menshi, ariko icyo ushaka kuvuga byibuze ugera ku nzozi zawe. Buriya ukora ikintu wishimiye nibwo ugikora neza, sibyo? Iyo ukora ikintu utishimiye you fail at the end. Thank you.
Thank you. Ntekereza ko ikibazo gikomeye, it's a tricky question because if I can start with my experience, nkirangiza secondaire namaze umwaka mbonamo ikiraga ndakora. Rwanda yari igezweho iza ifata cabinet crew ndapraying, maze kugera i Butare maze like 1 month baramfata. I remember nafashe valise yanjye ndafunga neza, je rentre ngiye mu ndege njyewe pharmacy rwose bye bye. Ngeze mu rugo urumva abantu bose baranyicaza barambwira ati nutiga uyu munsi opportunity ufite irabigiye, nyuma sinzi uzakwishyurira. Urumva babanza kugira ngo bambwire, ariko pour une jeune fille de 19 ans on te dit on va te payer 300 000, tu n'as jamais même touché 100 000, c'est ikintu kinini. Nagerageje kumvira ni nko kukubwira ngo simbizi hariya hari etage yubatse hari n'inzu ku ruhande. Ubwo rero nagerageje kumvira abavandimwe subira ku ishuri, ariko igitangaje nuko abantu bafashe icyo gihe baracyakora ka kazi. There is no improvement. So ntabwo navuga ko batishimye, maybe they are happy what they are doing, but I know myself, I'm so ambitious. So that time maybe I was going to gain those 300,000, but at the end of 2 years or 3 years I was not going to be happy. So having a focus and objectives in your life is very important, and you have to balance. Now you are going to finish the school, you are 22 years old, maybe 23 years old, you don't have responsibilities. Guys, do whatever you want to achieve, do whatever it takes to achieve whatever you want. Amafaranga azabura. Uyu munsi waguhaye akazi ka 500,000 uba ufite ibibazo bihura na 500,000. Wabona ka miliyoni uhita ugira ibibazo bya miliyoni 2. Wabona ka miliyoni 3 noneho isi yose ubona n'umuhanda wawubaka. So amafaranga ntazabe aricyo kintu cya mbere gituma uhubuka cyangwa ubuzima bwawe ntuzabutware mu ndorerwamo y'amafaranga. Cyane cyane ndabibwira abakobwa, ubuzima bwawe ntuzabutware mu ndorerwamo y'amafaranga. You can do, you can start small. You can start having those kind of jobs when you are not happy. You are not happy, but you are working, and in 5-10 years you are going to achieve more. So our role models, they are not the socialites. Our role models are real scientifics. Our role models, they are not the social influencers. Sometimes I say that I'm a social influencer. I don't like that kind of branding. Our our role models are those, is Marie Curie, Yeah, those are our role models. So people who are impacting the society, people who are changing lives in a better way, not in slang or things like that.
Jeff, can you please use 1 minute? I know you're not controllable with the mic, but...
So iki kibazo kiragoranye cyane, ariko njye nta nubwo mfite experience nyinshi cyane by the way. Ngewe ntabwo ndamara imyaka 5 uvuye hano kuba president wa RPSA, nubwo maze kunyura ahantu henshi. Reka mvuge ibintu bibiri byambayeho, only two, and I will conclude from there. Nkora muri Babel higeze kuboneka position muri Minisante nziza cyane numvaga nyishaka, and there was someone who was teaching us yakoraga muri Minisante. Aravuga ati yatwigishaga muri masters, aravuga ati I want you to take this position by and large. Ndaza kuvugisha Deje, I am recommending you. And I felt like wholeheartedly I wanted that position. Mura n'umuyobozi wari muri Minisante cyo gihe turicarana for 30 minutes. Arambwira ati you are highly recommended for this position, but for you to take up this position I would want you to come as an intern. Kuko nago biracyari muri process nagirajya hanze, so I would want you to come and intern, work as an intern. Mfite ibintu twaba dukorana bya data analysis, data entry, bla bla, arabisobanura, and then bizamfasha kubona ukuntu ubona iyo position. Honestly speaking, ubwo ndashaka ngo muze kugereranya na cya kintu cya passion. Hari n'ibindi bintu ushyira mu mibare, hari inshingano nimaze gufata zindi nari buvuge, ariko imwe muri zo nuko naratangiye no kwiga masters kandi niyishyurira. Byabaye ngombwa ko nyireka iyo internship. Narambwira ati rwose ntabwo biri bumundire, like I had to leave that. So that's the first time, because of reason X, I failed to go for my passion. So I failed to go for that. Ibara nababwiye ngo nitujya tuzana hano tukavuga, njyewe I don't like motivation speakers, and abantu tujye tuvugana barabizi ba Patrick, I don't like motivation speakers. Motivation speakers never tell you where they failed. They tell you only success stories. They don't tell you where they failed. At that point, I failed to take up that position. It was a good position. I was still young. 2 years, I think. It was 2018. When I came to university, kubona a special position, it would have meant a galaxy to me. Narayiretse. Suko nari nyaza. Now, icyo nicyo cyagihe hari izindi mpamvu zishobora kuza ukananirwa gukora cya kintu nkuko bari batubwiye. That was once. Second time is when this position yanguye muri Babel yaje. This position naganire cyane na comrade Morris. Geoffrey, uje muri retail pharmacy kweli? Like we were brainstorming, because these were people that I needed inspiration from. Je naguna dira nigeze nkora ho muri retail na experience no numvaga atari n'ibintu nkunda cyane. So when I was talking to one of our colleagues, kuko no kuganira n'abantu nabyo birafasha, elders, seniors. So nganira n'umuntu arambwira ati Geoffrey, turaganira mwereka where you want to be. Like I want to be in these big organizations like Chemonix, like like MTABs, nizo ugenda utangira hinjero, like UNICEF, WHO, stuff like that. Arambaza, where do you want to be? Like, I want to be like a supply chain specialist. Nibindi. Global health leader. Arambwira ngo kuki udashaka kujya muri position y'information. It's an opportunity in front of you. Ndabwira, really? Yes, I'm going to be leading this new company. It's a startup, it's an innovative company. Ariko ngiye gusubira bimwe mu byo byansabaga gusubira muri pharmacy, nkajya kuri counter, ngatanga imiti and all that. Things I had not dreamed to do. Not every pharmacist here wants to do that. Hari ababikunda, hari n'abatabikunda. Hari n'uko wavuga na supply chain hari utayikunda. Hari ukunda clinical, hari ukunda kuzakora stuff like that basically. Arambwira ngo Geoffrey, sorry you applied. Iyi niyo nzira yagufasha kugera aho ushaka kujya. You see? That's what they told me, and that's how I came in. But to assure you, nagiyemo namazemo igihe gitoya kwirwaga tugana na ba Morris, imiti mishigezweho ku isoko, uko bimeze ku isoko bihagaze, turi muri pharmaceutical business basically. Tujyamo turabikora, numvaga nabikunda cyane, ariko it prepared me a lot. Ariko kwa kundi uvuga ngo ugirisha ukavuga ngo ngiye muri iki kintu, this is what is helping me for my next move. So ukakijyamo wese ukagikora. Indeed, That was the only selling point I had for me to go for my next move. Now I entered into a global supply chain movement. Nibyo ngibyo nukuvuga ngo hari igihe ushobora gukora imibare ugasanga bikunda ko ushobora kureka ikintu ukunda ukanyura mu yindi nzira itari nziza kugira ngo uzagere ku kindi cyane, ariko n'igihe ushaka gukora imibare bikanga. So ngiye icyo uko nabigenje mu buzima bwanjye nuko muri imibare kureba ikitari buneze ibibazo ugashyiramo ya mibare yindi, what are other responsibilities. Niba hari uburyo ushobora kuza gufuwinga akazi ka 800 ukajya ku 200 kakazakugeza kuri 5,000,000, well and good. Ariko niba ari nta buryo ubwo ushobora kujya kuri ka kandi hakaba hari ibindi biri bupfe, you can decide to forego. Me, that's the kind of a motivational speaker I am. I'll tell you where you can fail. You know, motivation speakers are trained to tell you how you can start with 1 bean and have a restaurant. That's not me. Thank you.
Can we have your question?
Thank you. It's not just a question. We have here one of our sponsor homies. The managing director is a pharmacist too. I just want to hear from him how a pharmacist become a managing director of a videographer and photographer.
Okay, thank you. My name is Prosper. I'm a pharmacist. So I used to serve as research and education officer in RPSA, and the next year, the following year, I was the public health officer. So, but currently, I serve as managing director of Homies. The one the company sponsored this symposium because they approached the company as the one decided what to do. I gave them that sponsor. So what we do in Homies, so we are doing videos and the photos, and we are also having the transport, and we also having the studio, audio studio. Some of you will hear some songs like KIGALI, the fireman, like those rappers and others artists here in Rwanda. Those are coming from the Homies, the behind of that cameramans. So what we do, pharmacists, as the Jeff said, are not limited for any other responsibilities. If you call me to go in the pharmacy, so I will come and then dispense medicine with the good information. So then if you call me to manage the company, music company, as I do, so I have to serve. So, and what I have to encourage you, young student, don't limit yourself. Try to learn. If you learn, you will achieve. And then don't stop to study because you are there because of study. Extracurricular activities will help you to achieve your goals. While you are starting to face up with the world. I mean, once you graduate, you start to face up with the world or face up with the new life. So that's what you will use. So if you have that extracurricular skills, if you include the extracurricular activities like Jeff, I used to be with the Maeva. Maeva was student exchange officer on our mandate. Jeff was the president. All of them, they are using skills. Even they are using pharmacological skills, but the other skills, what I have to tell you, try to use your skills and to be included in other activities. But don't forget to study, because if you fail, they will fire you at the school, and then you lose everything. Thank you.
Yes, I want to add one thing from where Prosper ended. Twajyaga tuba stubborn cyane tukiri muri kaminuza, and we spend much of the time not in class. Nabyo mujye mubyirinda. You need to study. At times you could go to conferences. Ukava muri conference Dar es Salaam, ukajya mu yindi Accra, ukajya mu yindi Egypt, ukajya muri student exchange, then kuishuri bakakubura. We had terrible times with some lecturer. These people ntabwo banga extracurricular activities. If iyo babazanga, she wouldn't sit here for 2 days. This is an extracurricular activity, if I may say. She wouldn't sit here for 2 days, but we need to do it mu kigero. Okay? Hari abajyaga batubwire ngo uzasanga uri pharmacy student ngo uzasanga ucuruza amapine. I don't think it's a bad thing. Gusa icyo babaga bashaka kuvuga nuko waba waratsinzwe ukananirwa ku buryo ujya gucuruza amapine. Ariko utsinze you are licensed like he is, like I am, like she is, ariko ukaba wakora n'ibindi. Njyewe every time I'm not working in a pharmacy, my license is always valid 100% every year. Nibyo ndimo ngana na mwe. It's always valid. Sibyo? I can go. Nachuruza ibirayi, nachuruza n'ibindi, I don't care. Sibyo? So extracurricular activities tuzibalancing no kwiga nanone nidutsindwe. Ejo ntuzajya hariya nanone kuko n'ubundi muri societe mu mugambi uyu munsi baragutungura bakaguhagurutsa. Maybe these people know. Ngo muganga haguruka tubwira iki niki. You can talk to them. Ejo utazaba umumidioka. Mama Monique nukunda kutubwira ngo I don't like mediocres. Yigeze kumbwira ngo nari kuvuga igifaransa ngo so am mediocre. Ndabwira ariko I'm good at English. Tuba friends kuva icyo gihe tubishuti cyane. Urumva? So don't be a mediocre. No, be good at pharmacy ukore n'ibindi because you have the capacity to do both. All. Simple.
Just very briefly, the purpose of a degree is for you to be able, it's a proof that you can transform your life. You can take your life and make it productive. You can create what you want to become out of the degree. Whether you use the knowledge that you acquired in the university or you teach yourself other kind of knowledge to transform your life, that's the purpose of a degree. 2, for the ones who are younger, I encourage you to have a mentor. It's very important. What does a mentor do? It's somebody who guides you. Somebody up there, many years ahead of you, has made mistakes. And if you're following the same path, they will guide you to prevent making the same mistakes. It may be in form of a person, it may be in form of reading a biography, someone's biography, or even a story, a failure story or a success story. That's what I wanted to pass on. Thank you.
Thank you, guys. I think this was a very, very, very interesting panel. Do we agree? Do we agree it was interesting? Yeah. Okay. I want to leave with this because I believe what Geoffrey is doing, or even Christelle is doing, they had no idea that they were going to be where they are today when they were leaving pharmacy school. So you don't have to. You don't have to have everything figured out. It's okay if you leave the school with questions, as in, where am I going to fit in the professional world? It's okay. You just have to get the necessary exposure, be humble, as he said, and get ready to come in when the opportunity knocks your door. Do we agree? Thank you very much. Thank you, Christelle. Thank you, Geoffrey. Can we have a round of applause for them? Thank you. Please, guys, you continue to clap for them until they leave the stage.
Thank you very much. Thank you, Maeva. Thank you, dear speakers. We have really enjoyed this, and that's really what we want from this. So, as we are coming to end, I would like to welcome the symposium coordinator. I would like to welcome the symposium coordinator, and after giving us the resolutions from this symposium, he will call upon the president to close this. And personally, I'm not coming back here. So I thank you all for being with us. I thank our lecturers for being with us till this time.
You know she's based in Butare, but she's still here. Thank you very much. Thank you for the speakers who are here. Thank you for the people who followed us online. And every person who is here till this time. Thank you very much for our sponsors for supporting us. I know there are many who paid for students, who gave us the scholarship. Thank you for homies, for the pictures. They are going to be the memories. Thank you to each and every person that has participated in this symposium to be done. So the rest will be for the president and the coordinator. I have done my part. Thank you very much.
Good evening. I think there are people who are following online and physical. So thank you so much for your patience. So dear distinguished guests, speakers, moderators, participants and sponsors, on behalf of organizing committee, I am very heartwarmed for all to be with us in 11th RPSA International Pharmaceutical Symposium. We also recognize the presence and participation of the other student-based association, NEMSAR, which is Nursing and Midwifery Student Association. Where is the representative from NEMSAR? Thank you for being with us. We also recognize the presence of Medical Student Association. I don't know if the representative from MedSAR is still here. We also recognize the RVCP. So in these 2 days, we have been fortunate to have learned the identities from academicians, regulatory bodies, research industry, supply chain, and other areas. Moving from basic competence to modern practice require us to acquire knowledge, innovate, multidisciplinary collaboration, and community education that leaves no one behind. I am sure that our association, RPSA, will continue to get significant provision from diverse groups in the future. I'm taking this occurrence to thank the entire committee, as well as the audience for presenting their valuable views. I must also remark the proficiency, sense of the gratefulness to all speakers for sharing us with some finest strategies to move from basic competence to modern practice. All participants of this symposium are well inspired by your highly speaking words. I want also to extend my generous thanks to the sponsor, University of Rwanda, Pharmacy Department, National Pharmacy Council, Sun Enterprise, Africa Medical Supply, AfriFarm Limited, Sana Enterprise, IMAP Group Limited, Health Development Initiatives, HDI Rwanda, Homes Music, and RPSA alumni for their support and cooperation. It's not possible to thank everyone for such an appreciating involvement and the willingness you have expressed to finish the task. But your great efforts used to make this symposium happen successful is highly appreciated. God bless you all. Thank you. Welcome, President.
Thank you. The time is not on our side. That's why I want just to be brief. My remarks is about thanking everyone who are here now and everyone who supported for this event to take place. We have learned a lot within this symposium. We have gained the knowledge, we as students, and I hope professionals also have gained a lot of knowledge with this symposium. So I thank everyone participated and every speaker who passed in front of us to give us that knowledge is to build the future of us. So I just to recognize some people who helped us a lot for this symposium to take place. I recognize the University of Rwanda. This hall is for University of Rwanda, is for free, we didn't pay it. And all this sound system is for University of Rwanda. There's banners and that one outside, and even this pull-up is for University of Rwanda. So we just want to thank them. We also thank the people from NPC. They told me that there are a few here, Denise, and maybe they can stand up. People may greet them and his colleague if they are here. We just want to tell you to tell the boss, the chair, that we thank the support they offered to RPSA for this event to take place. We just also want to recognize these partners who helped us a lot. And by starting, I just want to see if there is someone from SAN. I know maybe there is no one, but we have their certificate here. We have also someone from SANA, Medical Supplies, maybe can step front to get the certificate for their recognition that they support us a lot. Photographer B. Thank you. The managing director and the pharmacist of Homies may step forward for the certificate of their recognition. They have helped us a lot by taking these pictures, and if you have seen yesterday, they were using like a camera. I don't know that thing, how it is called. That one which was surrounding.
It's called the crane.
Okay, thank you. That one is for the video for this event. They have took it as the best moment of this event, and when they finish editing, we will send it to you, and you just have a brief of this event within the video. Thank you for supporting RPSA.
I want to comment something. RPSA is not alone, because RPSA has helped us to be who we are today. Let me tell you something. For the first year I entered in the university, I didn't know to send an email. You are laughing. Most of you, I know that you don't know it before like that. But me, I learned to send an email, and those soft skills I'm using today for reading these homies. It's from RPSA. I thank RPSA. Wherever it's possible, I will be a spokesperson of the RPSA. Thank you.
I just want to see if there is some people from AfriFarm. Maybe not, but AfriFarm helped us a lot, not only for this event, also for the event of Kayumba. They have helped us a lot, and they are willing to keep supporting. So thanks to them. Africa Medical Supply, Shema Fabrice, he gave us a lot of support, including the COVID test we have received yesterday for 150 people. Everyone here was tested yesterday, so the kits and the people to test was from Africa Medical Supply. We just want also to thank IMAB for the great support they offered to us. They just paid for the banner, even if University of Rwanda has already paid for it. It has supported like 20 students to come for free. Thank you. I would just want also to thank HDI. They have supported us for this event. and they have offered like 20 scholarships for other students to attend. So thank you very much. So I want to thank everyone who have participated and who have worked hard for this event to take place, including my, at the first let me recognize someone I was forgetting, our doctor, Nyang. I don't know if she's still here. Maybe not here, but he helped us a lot. Without him, we couldn't have accomplished this symposium. Another round of applause to him. But also our department have helped us a lot by giving us the recommendations to ask for support and giving us different ideas on how we can prepare this. So thanks to them. The other people I want to thank is my organizing team. When the things goes well, the credit goes to the president, of course. But actually, president do nothing. The team do everything. President take credit. So my team, could you step in front so we can take a picture for your recognition for the things you do? Hurry up, please. Hurry up. We don't have time. The EXCO and the team for this symposium. Okay.
Mama. So alright. So now.
So thanks everyone who have participated in this symposium. I want to thank the professional pharmacists who were online and the students and every participant here. So this is the end of this year's symposium. The next event is about RPSA anniversary. It will be at Olympiad. The ushers will lead you there. So we will have the cake and cocktails and exchanging some input. Thank you. So this is the end. We need the closing picture with everyone. Everyone come in the front so we get the closing picture.
bapange mwana we kujya gutura bamwe bajya inyuma y'abandi abandi bace bugufi ntabwo uzingiye urabona wayifotora ntabwo iyi wayifotora ntabwo bapange bamwe bace bugufi gukora umurongo umwe wa
Thank you.